Today's genetic presentation is going to be on Fibrodysplasia Ossificans Progressiva. The photo on the right is a side-by-side comparison of a healthy skeletal system and one affected by FOP. Fibrodysplasia Ossificans Progressiva is a genetic condition where the muscle and connective tissues become ossified, which means they turn into bone. Trauma to the muscles or connective tissue can cause rapid ossification to the injured area, and viral illness such as influenza can cause flare-ups. Most individuals with this condition are born with malformed big toes, which is a characteristic distinguishable to this disorder. It's a very rare disease with only several hundred reported cases, and scientists and physicians believe it has only occurred in 1 to 2 million people worldwide. This condition is caused by mutations in the gene ACVR1, which is a gene responsible for muscle and bone development. Most cases result from a new mutation to this gene, which means there is no family history of this disorder. However, in a small number of cases, a child has inherited the mutation from an affected parent. It is an autosomal dominant disorder, which means that the mutation is a dominant allele located on an autosome, which is one of the non-sex chromosomes. With an autosomal dominant disorder, the disease can be passed down by the abnormal gene from only one parent. So FOP patients are heterozygous for these mutations, which is consistent with autosomal dominant disorders. The normal function of this gene, ACVR1, is to provide instructions for making the activin receptor type 1 protein, which is responsible for the development of bones and muscles. In normal skeletal maturation, cartilage is replaced by bone, which is called ossification. If a mutation occurs that affects the bone morphogenic protein receptors, then the protein is activated at inappropriate times and will cause an overgrowth of bone and cartilage.